All right, so listen to this. Imagine any medical image, like an X-ray or an ultrasound, anything, and it could be analyzed instantly. Like not even by a person, but like automatically.
And that's kind of the promise of MedSAM.
This new AI model that's got everyone in medical imaging really excited.
Yeah.
We're doing a deep dive today into the research paper called Segment Anything in Medical Images
Yeah.
to really understand what MedSAM is all about.
And it's pretty much exactly what you said. It's this AI that can just look at a medical image and tell you what it is, what's wrong with it, what might need to be looked at more closely.
Okay, so for those of us who haven't been like living and breathing AI, like break down for us why this foundation model thing is such a big deal.
Okay, so think about AI models up until now as like specialists. They're really good at one thing, but not so great outside of their niche. So you need a different AI for analyzing a brain scan versus like a lung X-ray, for example.
So MedSam is like the ultimate multitasker.
Exactly. It's trained on a massive, massive data set, over 1.5 million images,
Wow.
covering a huge range of medical imaging types, organs, and conditions. And the crazy part is, you can just give it a simple prompt, like a box drawn around the area you want to analyze.
Hold up. So you're telling me I can just point MedSam at like what I'm interested in and it figures out the rest. That's pretty wild.
Pretty much. It's called promptable segmentation, and it's one of the things that makes MedSAM revolutionary. It means you don't have to be an AI expert or spend hours training a model for every single task.
That's going to be a huge time saver for people in the medical field. What about this giant data set it was trained on? Like what makes it so special?
Well, it's not just the size, it's the diversity.
Hmm?
So they included 10 different imaging modalities, things like CT scans, MRIs, endoscopy, images, you name it, plus images from over 30 different cancer types and various imaging protocols. It's like they gave this AI the ultimate medical education, basically.
So it's not just a one-trick pony.
No, not at all. And that's really the key to its power. So this variety in the training data allows MedSAM to kind of learn a much, much richer representation of what medical images look like, making it much more adaptable for different tasks.
That all sounds amazing, but does it actually live up to the hype? Like, how do we know this thing really works?
So researchers did something pretty clever to test it. They gave MedSAM a bunch of exams, internal and external, to see how it performed.
Okay, walk me through this. What were they testing?
So they started with internal validation. It's basically giving MedSAM 86 different segmentation tasks. And they wanted to see how it compared to the original SAM model it's based on, as well as other specialized AI models that are designed for specific types of images.
How'd it do?
It aced the test. It not only outperformed the original SAM model, but it actually did as well or even better than those specialized models in many cases. So, for example, it could accurately segment a brain tumor on an MRI scan, which usually requires a dedicated model.
Impressive. So it can handle the complex stuff, but what about new situations that it hasn't seen before?
That's where the external validation comes in. They threw 60 new segmentation tasks at it, including data sets and types of images MedSAM had never encountered before. This was the real test of its adaptability.
So like a pop quiz
Exactly.
to see if
Right.
it really learned the material. What happened?
MedSAM just kept impressing. It consistently showed really strong performance even on these brand new tasks. They even had it segment a lymph node on a CT scan from a completely different data set, and it did it successfully. That's the kind of adaptability that really gets people excited.
Yeah, yeah. It's like it's actually understanding what it's seeing, not just
Yeah.
like matching patterns, right?
Yeah,
That's a big deal.
it is. And there's another interesting wrinkle to this. They found that the bigger the data set that MedSAM was trained on, the better it performed. So this, it might seem obvious, but it highlights this incredible potential of this technology.
So as more data becomes available, MedSim is just going to keep getting smarter.
Exactly.
That's mind-blowing.
Imagine what it could do with access to even larger, more diverse data sets. I mean, the possibilities are pretty remarkable.
Yeah.
But, this isn't just theory. The researchers also looked at how MedSAM could be used in the real world, like how it could help with annotating medical images.
Wait, hold on. Annotating.
Yeah.
What does that even mean?
So it's basically the process of manually labeling different parts of a medical image. So, for example, a doctor might have to spend time carefully outlining the boundaries of a tumor on a scan. It's critical, but it's super time consuming.
So how does MedSam help with that?
They did a study where they had experts annotate images both manually and with MedSam's assistance. And get this, using MedSam reduced the annotation time by over 80%.
Wow.
Yeah,
That's a massive time saving. Like think of all the things doctors could do with that extra time. Like see more patients, do more research.
exactly. It frees them up to focus on the things that really require human expertise. It's not about replacing doctors. It's about making them more efficient and effective. But before we get too carried away, let's take a step back and address the elephant in the room:
Oh, okay.
limitations.
So no AI is perfect.
Right.
So what are we talking about here? Like what can't MedSam do?
Well, one thing they pointed out is that the data set, while huge, is still a bit biased towards certain types of images. So there are a lot of CT scans, MRIs, and endoscopy images, but fewer examples of things like mammograms.
So it might not be as good at analyzing those less common types of images.
That's a possibility. And the other limitation is it can sometimes have trouble segmenting those thin branching structures like blood vessels.
Why is that? Too complex, even for this super AI.
It's more about the way it's prompted. So you remember those bounding boxes we talked about? Well, sometimes they just don't provide enough information for MedSam to accurately identify those tricky structures.
So it's like giving someone vague directions, They might end up in the wrong spot.
Exactly. But the good news is both of these limitations are things that can potentially be addressed with further development and fine-tuning. It's just the beginning for MedSam.
Okay, so it's not perfect, but still incredibly promising. Before we move on, I have to ask, what about the ethical side of all this?
That's a huge topic, and we'll definitely dive into it more in the next part of our deep dive. But for now, I think it's important to remember that AI is a tool. Like any tool, it can be used for good or for bad. It all depends on how we choose to develop and implement it.
That's a great point. It's up to us to make sure we're using this technology responsibly. So we've covered a lot of ground already. We've seen how MedSam works, its strengths, its limitations, but what does it all mean for the future of medicine? Like, where do we go from here?
That's the million-dollar question, and the one we'll be tackling next.
Flex.
So get ready to explore the potential of MedSam to revolutionize everything from radiology to drug discovery. We'll also delve into those ethical considerations that we just touched on, because this is a conversation that we can't afford to ignore.
You're listening to The Deep Dive, and we'll be right back with more on MedSam and its potential to reshape the future of healthcare.
Welcome back to the Deep Dive.
Yeah.
So before the break, we were talking about some of the limitations of MedSam,
Right.
particularly the fact that the training data, while massive, is still a bit biased towards certain types of medical images.
Right, like all those CT scans, MRIs, and endoscopy images, but fewer examples of things like mammograms. It makes you wonder, could this type of bias actually have real-world consequences?
That's a crucial question, and it really gets to the heart of why it's so important to be aware of potential biases in AI development. If a model is trained primarily on data from one specific group, or in this case, certain types of images, it might not perform as well when faced with data that's different.
So it's like studying for a test, but only focusing on one chapter.
Yeah.
You might do great on questions from that chapter, but completely bomb the rest of the exam.
Exactly, and in the context of medical AI, that could potentially lead to misdiagnoses or misdiagnoses. It really underscores the importance of having diverse and representative data sets when training these models.
So it's not just about making these models accurate. It's about making sure that they're fair and equitable across the board. That's a big responsibility.
Absolutely, and
Yeah.
and it's something that researchers are actively working on. There
Yeah.
are ongoing efforts to create larger, more inclusive data sets that better reflect the diversity of patients and medical conditions.
That makes sense. But even with a perfectly balanced data set, there's still the question of how these AI models will actually be used in clinical practice. Like how will they fit into the existing workflow of radiologists and other medical professionals?
That's another great point. A lot of folks, when they hear AI in medicine, they immediately jump to the conclusion that doctors are going to be replaced by robots. But the reality is far more nuanced.
Yeah, because at the end of the day, AI is a tool, right?
Right.
It's not about replacing human expertise. It's about augmenting it.
Exactly. The real potential lies in collaboration. So imagine a scenario where an AI like MedSam could pre-screen images, flagging potential areas of concern for a radiologist to review. This would free up the radiologist's time to focus on the more complex cases, the ones that really require their expertise.
It's like it's like having an extra set of eyes. Only these eyes never get tired and can analyze massive amounts of data in an instant.
Right.
That's going to be a game changer for efficiency.
It could be, and it could also lead to earlier detection of diseases, faster diagnoses, and ultimately better outcomes for patients. But it's important to remember that AI is still in its early stages in medicine. There's a lot of research and development that needs to happen before it becomes fully integrated into clinical practice.
And a lot of conversations that need to happen about how to do it responsibly. Okay, so we've talked about the limitations of MedSam and how it could potentially impact the roles of radiologists. But there's another big question we haven't addressed yet. What about all the other potential applications? We touched on things like drug discovery and surgery, but how realistic are those possibilities?
That's where things get really exciting. So remember how we talked about MedSam being a foundation model? Well, that's not just a fancy term. It means this technology has the potential to be adapted and applied to a wide range of medical challenges.
So it's like a platform you can build on, like a smartphone. You have the basic hardware, but then you can add all sorts of apps to do different things.
That's a great analogy, and the potential apps in the medical field are pretty mind blowing. So let's start with drug discovery. Imagine using MedSam to analyze microscopic images of cells and tissues, looking for subtle changes that could indicate the presence of disease or the effectiveness of a new drug.
So it's like having an AI powered microscope that can spot things that human eyes might miss.
Exactly, and that could lead to the development of new treatments and cures for diseases that are currently incurable, or take surgery. Imagine using MedSam to provide real-time image guidance during a procedure. The surgeon could see exactly where they need to cut, avoiding critical structures and improving accuracy.
That sounds like something out of a sci-fi movie, but it's not just about futuristic scenarios, right? There are more immediate applications too.
Absolutely. So think about areas like pathology, where doctors have to analyze biopsies to diagnose diseases. MedSam could help automate that process, making it faster and more accurate. Or in radiology, where it could help identify and track the progression of diseases over time. I mean, the possibilities are pretty much endless.
It's amazing to think about how this one technology could potentially touch so many different aspects of medicine. But with all this talk about the future, it's easy to get lost in the possibilities and forget about the present. What are the most important takeaways for our listeners right now?
That's a great question. I think that the key takeaway is that we're at a pivotal moment in the history of medicine. AI is no longer just a theoretical concept. It's becoming a reality, and MedSam is a prime example of that.
So what should people be doing with this information? Should everyone be running out to invest in AI companies?
Not necessarily,
Yeah.
but I think it's important for everyone to be aware of these advancements and to start thinking about the implications. AI is going to have a profound impact on our lives, especially in the realm of healthcare.
So we need to be informed, engaged, and ready to have those tough conversations about how to use this technology responsibly.
Exactly. The future of medicine is being written right now, and we all have a role to play in shaping it.
Well said. But let's be honest. There's still a part of me that can't help but get caught up in all the excitement. I mean, the potential is just so vast.
I understand, and I share your enthusiasm, but it's important to temper that excitement with a healthy dose of caution.
Yeah.
As with any powerful technology, there are risks and challenges that we need to be aware of.
Right. It's not all sunshine and roses. There are potential downsides, unintended consequences, and ethical dilemmas that we need to address head on.
Exactly, and that's what we'll be diving into in the final part of our deep dive. We'll explore some of those potential pitfalls, the ethical questions that arise, and the challenges we'll need to to overcome to ensure that AI is used for good in medicine. Stay tuned because this conversation is far from over.
Welcome back to the deep dive. We spent this episode exploring this groundbreaking AI model, MedSAM, and its potential to like completely revolutionize medical imaging.
Yeah.
I mean, it can analyze scans, maybe even help discover new drugs.
Right.
But like with any powerful technology, there's always a flip side.
Absolutely. We've talked about, all the amazing potential, how this could really transform healthcare, but we also have to acknowledge the potential pitfalls and ethical dilemmas that inevitably come with a technology this powerful.
Right, right. So let's dive into that a little bit. Like, what are some of the things that worry you about AI and healthcare? Like where could things go wrong?
Well, one of the biggest concerns, and this is true for any AI really, is unintended consequences.
Okay.
We're still really in the early stages of developing and deploying these models. And it's kind of impossible to predict every possible outcome. There's always the risk that, an AI could make a mistake or be used in a way that wasn't intended and that could have serious implications for patients.
Yeah, that's a scary thought. It's like giving someone a powerful tool, but without a full instruction manual.
Right.
We need to be extra careful with how we're using this technology.
Exactly. And it's not just about the technology itself. It's about the people using it.
Right.
We need to make sure that doctors, nurses, other healthcare professionals are properly trained on how to use AI tools effectively and ethically.
So it's not just about building smarter machines. It's about building like smarter systems.
Yes.
We need to be thinking about that human element just as much as the technological one.
Absolutely. And then there's the issue of transparency. These AI models can be, incredibly complex, and even the experts don't always fully understand how they work.
Right.
And this lack of transparency can be a real problem, especially when it comes to things like accountability. If something goes wrong, who's responsible?
That's a tough question. It's like blaming a calculator for a math error.
Yeah.
The tool might be faulty, but it's ultimately the person using it who's making the decisions.
Exactly. It's a complex issue, and there are no easy answers. But these are the kinds of conversations we need to be having as a society. We need to be thinking about how to regulate the development and use of AI in healthcare, how to ensure patient safety, and how to maintain public trust.
It's a lot to consider. It's almost like we're entering this uncharted territory with both amazing possibilities and potential dangers.
That's a great way to put it. And it's why it's so important to approach this with a sense of both excitement and caution. We need to embrace the potential of AI to improve healthcare, but we also need to be vigilant about the risks. It's a delicate balance.
So where do we go from here? What are the next steps?
Well, I think the most important thing is to keep the conversation going.
Yeah.
We need to be talking about these issues, debating the ethical implications, and working together to develop solutions. This isn't something that can be solved by one person or one company or even one government. It requires a collective effort.
So it's about fostering that dialogue, not just among experts, but also among everyday people. After all, it's our health, our lives that are ultimately at stake.
Exactly. This isn't just a technological issue. It's a societal one, and the choices we make today will have a profound impact on the future of healthcare.
Well said. It's been a fascinating journey, exploring the world of MedSam and the future of AI in medicine. We've seen the potential, the challenges, and the ethical dilemmas that come with this powerful technology. It's a lot to process, but ultimately it's a conversation that we need to be having.
I completely agree. The future is unfolding before our eyes, and it's up to all of us to shape it responsibly.
Well, thank you for joining us on the deep dive. We hope this has given you some food for thought and maybe even sparked some important conversations. Until next time, keep exploring, keep questioning, and keep learning.